This podcast represents a brief history of the law relating to the issues raised. This should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Welcome now to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, hear from different members of our health team with expertise in the area.
Allied health professionals such as physiotherapists, occupational therapists, speech pathologists, podiatrists and psychologists play a crucial role in helping individuals maintain and improve their quality of life. But have you ever stopped to consider how these professionals are regulated in New South Wales? And what does that mean for the safety and well-being of patients? Joining me on today's episode of Hicksons Health Hour to discuss this topic with a specific focus on a recent ban impacting chiropractic practice is Victoria Asquith, an associate in our health team here at Hicksons. Welcome, Victoria.
Thanks, Meesha.
So let's start by understanding what we mean when we refer to allied health professionals.
Well, these are the healthcare professionals who aren't doctors or nurses, but are still essential to patient care. They assess, diagnose, and treat a range of physical and mental health conditions. The allied health professionals currently registered with APRA are chiropractic, medical radiation practice, occupational therapy, optometry, osteopathy, pharmacy, physiotherapy, podiatry, and psychology.
So as with medical professionals, there's presumably a system in place to ensure allied health practitioners are appropriately qualified and undertake ongoing professional development and adhere to professional standards.
Correct. Allied health professions are either regulated through the National Registration and Accreditation Scheme, NRAS, or are self-regulated. The NRAS is maintained by the Australian Health Practitioner Regulation Authority, also known as APRA, and ensures that only suitably trained and qualified practitioners are registered. Each profession has a national board which is responsible for overseeing education standards, managing complaints against practitioners, and verifying that practitioners have met the educational standards.
So we recently saw one of these boards function in an attempt to protect public safety whilst also supporting consumer choice.
Yes, earlier this year, the Chiropractic Board of Australia again placed an interim ban on the practice of spinal manipulation for babies under 2 years of age, pending further discussion with state, territory, and federal health ministers. The chiropractic profession, which focuses on the diagnosis and treatment of musculoskeletal conditions, often includes spinal manipulation as part of its therapeutic toolkit. However, spinal manipulation, particularly in infants and young children, used to manage issues of colic, back and neck pain, ear infections, and twisted neck, has been a controversial issue for some time. While spinal adjustments are a routine part of chiropractic care for adults, the anatomical structure of an infant's spine makes it far more vulnerable. Serious concerns were raised about the practice following a 2018 social media post of a video showing a Melbourne chiropractor manipulating the back, hips, and collarbone of a 2-week-old baby. The baby is shown crying as the chiropractor uses a spring-loaded device called an activator on its neck, tailbone, and spine. In May 2019, the Chiropractic Board of Australia set an interim policy on spinal manipulation for infants and young children, while an independent review of the practice was carried out by Safer Care Victoria. Consequently, the review found that the evidence base for spinal manipulation in children was very poor. In particular, there's been no studies performed in Australia at the time. As part of the study, the comprehensive review of the literature failed to identify any strong evidence for the effectiveness of spinal manipulation for a variety of conditions for which children are widely offered chiropractic manipulations. In November 2023, the ban was lifted following changes to the CBA guidelines. The updated guidelines were based on findings from a systematic review commissioned by APRA regarding the effectiveness and safety of spinal manipulation in children under 12. Overall, the findings of the update produced by Cochrane Australia did not alter the conclusions reached in the original review that, due to the paucity of studies and the lack of reported information on the specific treatment techniques employed, it is difficult to draw conclusions about the safety and effectiveness of spinal manipulation in children. while acknowledging that both the Cochrane Australia and the Safer Care Victoria studies, as well as others, found not enough research has been done to draw conclusions about the safety and effectiveness of spinal manipulation in children, the board still updated its guidelines to allow the practice to resume. It said notification data to the Health Practitioners Watchdog, APRA, and independent review consultation by Safer Care Victoria revealed no reports of serious harm in children receiving chiropractic care in Australia. However, as previously stated, the Chiropractic Board of Australia has in June this year reinstated the interim ban following a request from Australia's federal and state health ministers. In response, the Australian Chiropractors Association said it was disappointed with the reinstatement of the ban, saying spinal manipulation was not the full picture of the treatment they offered young children. The association's president, David Cahill, called it a knee-jerk reaction. Dr. Cahill said there had been no evidence of a child harm in Australia, and he hoped to see the ban lifted. However, health groups, including the RACGP, raised concerns over this procedure. Dr. James Best, Sydney GP and chair of RACGP Specific Interest Children and Young Persons Health, labelled spinal manipulation for babies as a reckless practice that presents potentially grave risks. Dr. Best said that there was no safety data on spinal manipulation in children, with safety concerns are raised due to the autonomy and softness of children's spines, with them being more flexible and particularly more prone to damage by manipulation. Further, the Australian government's Therapeutic Goods Administration has cited concerns about a number of reported adverse effects, some of which involve infants.
So not surprisingly, there remains a divide on this issue.
Yes, while some chiropractors are supportive of the ban, acknowledging the need of increased regulation to ensure patient safety, especially when it comes to vulnerable patients, others have expressed frustration, viewing the ban as an overreach that infringes on their clinical autonomy and their ability to treat patients in the way they see fit. Some have argued that restrictions on spinal manipulation are unjustly punishing the profession based on isolated incidents rather than a broader evidence-based review. They stress that many chiropractors are well trained to handle paediatric patients' safety and responsibility.
So what does this mean for chiropractors?
Well, for one, chiropractors who wish to treat infants will now have to be even more cautious. They will need to demonstrate clear clinical justification for any treatment provided to children under 2 and ensure that the treatment is both safe and evidence-based. The reinstatement of this ban underscores the importance of ongoing research and dialogue within the medical community. As the community's understanding of paediatric health evolves, so too must the guideline and practices of those who care for the young and the vulnerable.
Thanks for being here, Victoria, and thank you to our listeners for joining us on Hicksons Health Hour. Stay tuned for our next episode where we continue exploring the intricate interplay between medicine, law, and society.